Oh, hello. Thanks for tuning in. My name's Rob Tart, and this is Pi's Perspective. Okay, Fluffy, we gotta go. People are waiting on us. Fluffy? A 29-year-old Brazilian man named Edilson Nascimento is recovering from a 3-hour surgery. Surgeons removed a 4-inch blade that had been stuck in his head for 3 years. He was apparently in a bar fight back in 2007, and he was attacked and stabbed in the head while walking home. So when he went to the hospital, the doctors feared that removing the knife could cause brain damage. So instead of removing the whole knife, they removed the handle and left the blade inside the man's brain. Now I gotta wonder, was this really the only medical option at the time, leaving a blade in someone's skull? Hey guys, let's just snap off the handle, cover it with some gauze, and send this guy on his way. I think living your life with a shank in your brain probably poses a few problems. Trying to explain why the metal detector keeps going off at the airport could be an issue. Can you imagine the look on the airport personnel's faces when they put him through one of those body scanners? Although technically he is concealing a weapon. What if he actually gets into a street fight and he needs the blade to defend himself? It would be entertaining to actually watch him try and pull the blade out. Or what if this guy walks beside one of those magnetic knife holders? Depending on the strength of the magnet in the knife holder, pulling his head off could require the help of others. Okay, probably not, but it kind of paints a funny picture, or a animation in this particular case. What about if he's applying for life insurance? Listing his medical history could be pretty interesting. I'm pretty sure there isn't a checkbox for, do you have a knife in your melon? I guess he could try to explain it in that little box that's labeled other. Now after enduring 3 years of intense headaches, the guy decided to take the risk and have the surgery done. Intense headaches? From what? Now when you tell people you have a headache of monumental proportions, the first thing they do is offer you some Tylenol. But unfortunately for this guy, Tylenol doesn't offer a foreign object lodged in my cranium strength. Alright, who wants ice cream? We have the thumbs upsicle, the subscribe-sicle, the 3-flavor fave-sicle, and the comment on a stick. Please, help yourself to anything you like. A surgeon in Germany was charged with assaulting 2 of his colleagues. Now what makes the story interesting and a little frightening is it was while he was in the middle of surgery. The surgeon punched the anesthesiologist to the ground and then started kicking him. A 60-year-old nurse tried to intervene, at which point he verbally abused her and elbowed her in the chest. Now the surgeon's excuse was that he had already done 5 operations that day. I guess this surgeon felt that the stress of doing 5 operations in one day entitled him to start a rumble in the operating room. Now I'm pretty sure there's nothing in the Hippocratic Oath about assaulting co-workers. I gotta wonder what the anesthesiologist was doing that would warrant such an attack. Was he taking hits of laughing gas and then giggling on the floor uncontrollably? Maybe he took some of those surgical tongs and used them to pitch the doctor's ass. Or maybe rolling up balls of gauze and flinging them at the doctor while he's in the middle of surgery. And then when the doctor looks over to see who's launching balls of gauze at him, you point to the nurse and blame it on her. And what about the poor patient? Can you imagine waking up in the middle of surgery? You ask the nurse, why am I awake while my intestines are still hanging out? She then informs you that your anesthesiologist is laying on the floor in the fetal position with multiple injuries. When you ask what happened, she informs you that the surgeon who was operating on you decided to bitch slap your anesthesiologist. Now what's this poor guy to do? Get up and walk away right after I gather up my innards and tuck them into a duffel bag? Tell the doctor that you plan to lodge a very strong complaint? The last thing you want to do is piss off an already violent doctor before he has a chance to sew you up. You're liable to end up with a few surgical tools left in your abdomen. Or worse, he may start laying a smackdown on you. I would imagine that repeated blows to exposed organs is probably not conducive to staying alive. This week's question is, think of some other issues that could arise from having a 4-inch blade lodged in your brain. Anyway, that's all I have for this week. Thanks for watching, and remember, it's not necessarily right or wrong, it's just my perspective. Alright, Fluffy, I'm getting kind of tired. Yeah, mule, yeah! No? Fluffy? Doctors feared that they removed the knife handle and then left the blade. They removed the blade. I mean, depending on the strength of the knife. A surgeon in Germany was charged with assaulting 2 of his colleagues. This week's question is, think of some other issues that could arise. Think of some other issues that could arise from having a 4-inch brain